Hey everyone, this is Nick here. Thank you all for tuning in again to another YouTube video. And like the title says, today we're going to talk about how to keep your gut health in check if you're having to take a course of antibiotics. Now, it's become almost the norm in our society to demonize the use of antibiotics. And a lot of that has to do with some of the known long-term implications of using antibiotics. So many common side effects of using antibiotics include intestinal permeability or leaky gut, Clostridium difficile infection, which we'll get into more in a little bit, antibiotic resistance, where literally the bacteria you're trying to kill off become resistant to the antibiotic you're giving it. You could actually have an allergic reaction to a particular antibiotic. A lot of people get antibiotic-associated diarrhea from taking them. And probably the most demonized and the most well-known side effect of antibiotics is a disruption of the normal gut bacteria. And some studies even show that it takes up to 6 weeks after stopping antibiotics for your gut bacteria to return to pre-antibiotic levels. And right in line with that, I've had many patients tell me that they believe a lot of their current health issues are due to overuse of antibiotics in childhood. And then there is some good mechanisms and some good theorized mechanisms behind how this could happen. A lot of antibiotic use as a child could disrupt that normal bacterial flora. And I mentioned it takes 6 weeks to return to normal. Well, if you're continuously using antibiotics, and you're continuously disrupting and bombarding that normal microflora, it's going to be hard for it to maintain its health. And there is implications for a disrupted microbiome, dysbiosis, and an increase in likelihood of autoimmune conditions such as type 1 diabetes, Hashimoto's, and even inflammatory bowel disease. And because of the proposed link that I just mentioned, some, like I said, integrative alternative providers will caution you against ever using antibiotics. And I think we need to understand that antibiotics are one of the marvels of modern Western medicine. Conditions such as rheumatic fever and STDs from gonorrhea infection were previously pretty unresponsive to a lot of the therapies that were developed until antibiotics came along. And the trouble comes from the over-application or chronic use of these antibiotics. And I want to put a message out there that just because you took 1 dose of antibiotics when you were 10, that does not mean that is the reason you developed an autoimmune disease when you're 30. And in today's video, I want to discuss with you all strategies and tips to help support your gut and keep it thriving both during antibiotics and then after you finish taking your antibiotics. Now, antibiotics are most commonly prescribed for acute bacterial infections, and typically they're prescribed between 3 and 10 days. And one of the more immediate side effects that one can experience from antibiotics is a Clostridium difficile infection. And that infection happens because of the disruption of the normal flora from antibiotics, and C. diff is normally present in the gut, but when you kill off a lot of the good guys that keep C. diff at bay, C. diff is allowed to grow and itself thrive, and that's when you get the hallmark symptom of diarrhea, and no one really wants to have to experience diarrhea. And as I said in the outset, no one really plans to take antibiotics, but sometimes life happens. And ironically enough, once you develop C. diff in the hospital, typically the next course of treatment is to then give antibiotics for the C. diff infection. First off, we're going to discuss the idea of taking probiotics. As I've discussed in previous videos, probiotics don't actually colonize the gut. But what probiotics can do with antibiotics is help with some of the symptoms and the side effects associated with it. And there's one study in particular that I found where taking a multi-strain probiotic while also taking antibiotics for C. diff led to a reduction in symptoms of diarrhea for the group taking the probiotic versus placebo. Now, they also found that the group taking the probiotic there was no real impact on their overall microbiome. So again, highlighting the fact that probiotics don't colonize the gut, but what I'm speculating from that is that probiotics help improve the overall function of the gut, and as a side effect of improved function, you get less side effects of diarrhea. I just think antibiotics are too powerful for probiotics to have a real effect in terms of the composition of the microbiome. Probiotics themselves also have antimicrobial activity, so probiotics can actually be a good adjunct to any other sort of herbal antimicrobials, or if you are taking antibiotics to eradicate something, probiotics can help eradicate that particular pathogen. Next, we're talking about diet. And as I previously mentioned, most antibiotic prescriptions are written for 3 to 10 days. So to be honest, I wouldn't really recommend changing your diet. If your physician has prescribed you antibiotics, hopefully their goal in doing so is to try and kill off a particular organism. And dietary changes could help with some of those symptoms of the side effects of antibiotics or the infection, but they're not really gonna help kill off the infection to the degree that antibiotics will. Now, we touched on probiotics, but what about adding probiotic or fermented foods such as kefir? And there actually is a trial out there that assessed the impact of children with an upper respiratory tract infection using kefir in conjunction with antibiotics, and unfortunately the children taking kefir had the same amount of antibiotic-associated diarrhea as the children taking kefir without organisms added to it. So if I were to have to take a course of antibiotics for anywhere from 3 to 7 days, I wouldn't really make any massive dietary changes during that time period. I may take some probiotics to help with the side effect of diarrhea and even leaky gut, and to further support leaky gut, which we'll get into here in a second, I would probably add in some L-glutamine and some vitamin D while taking antibiotics. And now we're going to talk about strategies and tips to incorporate for your gut after you're finished with the course of antibiotics. And to me, this is the more important time to pay attention to. And this is the time when I would really hammer the gut with probiotics, with as many different dietary foods as I could, and fermented foods and a lot of prebiotic fibers from dietary diversity, to really just throw as much nutrients and food supply to allow the good guys to grow. And this might also be a good time for you to incorporate some green and some red juices, because typically those are formulated with 30 to 40 different plant compounds and extracts and fibers that again are just going to add more fuel and more nutrients to more good guys. And we know that one of the causes or potential causes of leaky gut is a disrupted microbiome. So if you work on restoring the microbiome, you can help with some of those other side effects, such as leaky gut, because antibiotics really alter that microbial environment. So once you finish them, you have this sort of open window where the microbiome is really susceptible to change, both for the good and unfortunately for the not so good. So that's why I would throw as many different prebiotic fibers and vegetables and supplements to really increase the diversity of my microbiome. Additionally, you may even want to consider adding in supplemental butyrate. Butyrate is a short-chain fatty acid, and short-chain fatty acids act as fuel supply for the cells that line the gut, aka helping to prevent leaky gut. And they are created by bacteria eating off of these different prebiotic fibers. Because of that, short-chain fatty acids such as butyrate are now kind of being looked at as postbiotics, and you're seeing more and more supplements on the gut health market that are tied to improving your short-chain fatty acid status, aka butyrate supplements. And there's a really good article from Lucy Mailing, who's a PhD, who talks about that antibiotics alter the pH in our large intestine, and that's what a lot of the side effects come from. So adding in supplemental short-chain fatty acids can help restore the pH back to what it was previous. But there's pretty sparse data on humans for using supplement or butyrate with antibiotics. So from that regard, I would just continue to do things in your lifestyle to improve your short-chain fatty acid status, such as a diverse diet, exercise, stress management, proper sleep. You know, all those big foundational lifestyle pillars are still the things that are going to give you your most bang for your buck. And I would continue to support leaky gut for at least 2 to 3 weeks after the course of antibiotics, using things like probiotic, like L-glutamine, vitamin D, colostrum, and even zinc carnosine. And what symptoms should you be looking out for if you're incorporating all these strategies to know if they're actually working after antibiotics? Well, number one is your general digestion. So is there a huge change in bowel habits, such as constipation or predominantly diarrhea? Are you seeing an increase or a decrease in your amount of food reactions or sensitivities to smells or different chemicals? Do you have a change in the amount of joint pain you're having without a big change in your exercise routine? Do you have a big change in your cognition and your kind of mental capacity? And do you have a change in your memory? Are you finding you walk into rooms and forget why you're there, or you're forgetting appointments, or you're just having general brain fog, ironically enough? These are all symptoms that can help lead you in the direction of potential leaky gut or lack thereof symptoms. Maybe you've supported leaky gut well enough. And just some last little food for thought here. Was the reason that you got that strep throat or the sinus infection in the first place because you had a lack of antibiotics? Or was there some sort of immune dysregulation that was going on to lead you to be prescribed antibiotics? And did you know that nearly 70% of your immune system resides within your gut? To me, this is all just another reason to really focus on gut health and the far-reaching impact the gut can have on your immune status, your metabolic health, and your overall health. Now, thank you guys for tuning in to today's video. I hope you found it somewhat informative, and if you did, please leave it a like or a comment in the description box down below. That really helps the channel grow and help get the word out there and help grow the awareness of taking back control of your gut health. And subscribe if you all want to see more videos like this. And as always, guys, trust in your gut.